Hi everyone, good evening and welcome to the session on smart strategies to study in first year MBBS. So, this session is for those of you who have cleared your NEET UG examination with flying colors, who have gotten admitted in medical colleges already, right? And some of you would have even started the course, and some of you would be eagerly awaiting to start the course. And this is for all of you. And first and foremost, my heartfelt congratulations for you having reached this stage, right? Because not everybody gets to reach this stage because we are one of the very few. We are the chosen people who will be entrusted with people's lives. So you deserve a congratulations. So that is to start with. And though, be it a voluntary decision or an involuntary decision to get into medicine, I know some of you still have your own doubts, right? Yes, I got into medical college. Yes, I feel proud of it. But is this the right pathway for me? Because I keep getting to hear that this course is saturated. Some say, no, this is not as fascinating as it used to be. And people say that I will have to work hard for the next like 12 years for me to settle in life. So I keep getting mixed inputs. So is this the right path for myself? I know some of you would be battling with that question in your mind. Okay. The good news to all of you is yes, this is the right pathway for you. Okay. And if you're asking me why, the reason is this is a totally relatable course. Why am I saying that's totally a relatable course? Because in this course, what you learn, you will see. Okay. And vice versa. So you get to see what you learn and you will. Yeah. Hi, Nikita. So we were discussing about whether this is the right path for you, right? If you have that question in your mind, my answer to it is yes, this is the right pathway for you. Because this is a totally relatable course. You get to see what you learn and you learn what you're going to see, right? So it's completely a professional course. For example, one day you will be taught about coronary circulation. The other day you will be taught about cardiac biomarkers. And then in early clinical exposure that is being conducted in the first year, you will be taken to a laboratory where you're shown a report. And that report will tell you about what? It will tell you about CK values, it will tell you about CKMB values, TROPI values. You see that those are elevated and you will be able to make a diagnosis of myocardial infarction, right? So what else would you need than this? Do you think anybody can expect more than being trusted with somebody else's life? No, right? So this is going to be the most gratifying field. So don't have any doubts about it. You have chosen the right path for yourself. Okay. That being said, don't you know that Spider-Man, right? What did Spider-Man tell all of us? He said, with great power comes great responsibility. When somebody is ready to trust their life with you, then that comes with a very great responsibility of you having to commit your life to this course, right? You will have to embrace this course in such a way that at the end of the course, you become a compassionate and confident physician, right? Who will be able to handle any curveballs which a clinical course would throw at you, right? So that is possible only when you commit yourself to this course, only when you embrace this course. Okay. So what does it mean when I say you'll have to commit to this course? Am I saying you'll have to commit your entire youth to this course? Am I saying that you will have to study for 12 hours a day? Am I here to say that no, you will not have fun during the course? The answer is no. Okay. So having fun in life is non-negotiable. Okay. Yes, you can have all the fun that you want, But let me tell you one statement. Yeah, this is another happy news for you. You have not only chosen the right path, I'm also going to give you another good news. The good news is 2 hours a day, right? 2 hours a day reading at the right time in the right way using smart strategies can make you a topper, which 10 hours of random reading cannot. Do you understand this? You don't have to learn 10 hours a day. You don't have to learn 12 hours a day. Just 2 hours of reading, but it has to be done at the right time in the right way using smart strategies. I can hear you all asking me, what does right time mean? What does right way mean, right? Let me address the first question here. What does right time mean? For that, you have to understand that, you have to understand that consistency beats intensity, right? What does it mean? You're going to run a marathon here, right? The next 5.5 hours, you're committed for completing this course, right? So you're running a marathon. It is not a sprint race. So it is not about spending 12 hours a day during the initial part of the phase and then getting burnt out and not even working for half an hour in the later part of the course. It's all about consistency. It's all about showing up every day. Okay, so when I say consistency, how long should I study? That is your question, right? I would say every day you have to spend 2.5 hours, right? After your college hours, probably it gets over by 4 o'clock in the evening. After that, just commit 2.5 hours of your evening for studying. And how am I going to segregate that amongst the 3 subjects? Distribute it among the 3 subjects. You know, anatomy is a bulkier subject, right? 1 second, I know what is happening. Yeah. So anatomy is a subject with volume, right? For which you can commit 1 hour a day. For physiology and biochemistry, physiology is completely conceptual. You'll be able to understand it just in one reading. So for physiology, you can allot 45 minutes. For biochemistry, you can allot 45 minutes every day. Okay, so this is how you will have to plan your day. Okay, this is not going to be that difficult, spending 2.5 hours after the college time. Okay, now I know you will be asking me, how am I going to spend this 2.5 hours? So 1/3 of the time that you have allotted for a subject should be devoted for pre-class reading. So what is pre-class reading? The next day, the topic that is to be discussed is already informed to you. Because CBME, right? So competency based medical education, this curriculum mandates that every college sends a schedule well ahead. So everybody has to stick to that schedule, which means you have a schedule which is pre-planned, predetermined. So you know what is the session or what is the topic that will be discussed for the next day. When I say 1/3 time, for 60 minutes, 20 minutes of the time that you have allotted for anatomy has to be devoted for pre-class reading. Right? So in pre-class reading, just read the entire topic. You don't have to understand the topic. Just read the entire topic. Get familiarized with those facts and concepts. Okay, so get familiarized with those facts and concepts and activate prior knowledge. So how does that help? When you're already familiar with those terms, when your faculty comes and teaches you about those facts and concepts, you will be able to absorb it quickly. Okay. Okay, so that is the advantage of pre-class reading. Now about post-class reading, right? So what you do in post-class reading depends upon what you did during the lecture class. Right? So about lecture classes, attending lecture classes. During my undergraduation days, right? So what we used to do was, during my undergraduation days, what we used to do was, we used to be very desperate in attending classes, particularly if it's a clinic, right? Clinic sessions. And more so if it's a clinician who has a passion for teaching. So in that case, all of us would be competing with each other to go and be there in the lecture class much ahead. And I don't see that desperation these days, right? So the reason behind that desperation missing now is all of us have multiple resources. We are not dependent only on the lecture that is being conducted by the teacher in your college, right? So we take it lightly. We think if at all I'm attending a lecture class, it's for my attendance. Okay, I'm going to strongly discourage that habit. Okay, do attend every lecture class religiously. Okay, not just for attendance. You will have to attend every lecture class, and you will have to be mindful, right? You will have to be mindful during the class. And how does that help? Yes, you all have a favorite teacher. You all have a favorite way of teaching. Now, irrespective of whoever is teaching that particular lecture class, please ensure that you attend that class and you be mindful during the class. Because the number of facts and the number of concepts that you're able to grasp during a lecture class is unmatchable. It is unbeatable. You cannot reach that level just by reading it from a textbook or from any other resource. So all of you, please take a resolution to not skip any of the lecture classes and to be mindful during the class. Okay. And what is more important is you will have to take notes. Okay. So if you're asking me, what should I take as notes? Should I take notes of whatever I've understood during the class? My answer is no. Okay, if you have understood a fact, if you have understood a concept, you don't have to write it in your book, because we are in an era of information. That fact that you have understood, that concept that you have understood, you will get an access to even after you come back. So what will you write as notes? I want you to write as notes those facts and concepts which you have not understood during the lecture class, so that when you come back, you will be able to refer to the various resources that you have to understand it. Do you understand this? So you will have to know what to do and what not to do. So attend lecture classes, be mindful during the class, take notes of whatever you have not understood, come back and ensure that you take steps to understand those facts and concepts. So this is about what to do during your lecture class. Now about your post-class reading. Okay, with respect to post-class reading, the 2/3 of the time that you have allotted for all these subjects should be used for post-class reading. And I can hear you all asking me, when should I do this? When should I read after the class? Do I accumulate everything and read it during the weekend? Or do I give some time so that I assimilate all the facts and concepts and then I read it after some time? The answer is immediate, right? When should you read the topic that is being discussed? It has to be immediately read, because how many ever times a particular topic is being discussed in the session, right? In the lecture class, they might repeat a fact multiple times. They might repeat a concept multiple times. But what gets registered in your cortex is called as a short-term memory, right? That stays only for few hours. And your responsibility is to convert that short-term memory to long-term memory. When should you do that conversion? That conversion has to be done before the short-term memory vanishes. When does short-term memory vanish? The very same day. Okay, so post-class reading will have to be done the very same day. Come back, use 40 minutes for anatomy to revise whatever is being taught during the lecture class that day. Okay, that immensely helps. And also remember that it's all about spaced repetition. So what do I mean by spaced repetition? The first time you're listening in the lecture class, actually that's the second time. First time it's a pre-class reading. Second time it's the lecture class that you're listening to. And the third time it's a post-class reading. Okay, that is not enough. What are you supposed to do for spaced repetition? Read it again during the weekends. Okay, during the weekends, no, you don't have to spend the entire weekend reading. Just spend 5 hours during your weekend for reading. Okay, so if you had spent 40 minutes for post-class reading during the weekday, during the weekend, 80 minutes spend and you read the entire week's sessions. Okay, so that is called a spaced repetition. If you do the spaced repetition, no subject will look volatile. Okay, so weekend reading is also essential. So that's about post-class reading. Okay. Now, yes, I've been repeatedly saying you have to read pre-class, you have to read post-class, but how should you learn a topic, right? There is a way that you should learn a topic. I know all of you have finished your NEET UG examination, which is an MCQ based examination. So you have all been tuned to read every paragraph one by one, assimilate, analyze and understand and find out what are the probable MCQs that can come from that paragraph and memorize those facts, right? So that is how you have been always tuned to do. But now the case is different. Here it's not an MCQ based examination if it's a first year MBBS. So it is going to be a subjective question paper wherein you are expected to write an essay and short notes and short answers. And it's not just about being able to answer in an examination, right? Your ultimate goal should be to become a good clinician. And that is possible only when you learn every topic conceptually. So how are you going to learn every topic conceptually? First, read a topic, get a big picture out of it. Do you understand this? So don't read paragraph by paragraph and don't just memorize it paragraph by paragraph. What I would want you to do is, if you're learning about respiratory physiology, just an example, okay, respiratory physiology. In the textbook, what you would see is first they would give you physiology of respiration, and then they would talk about the various volumes of lungs, and then they would discuss about pulmonary function test, and then they talk about alveolar ventilation and blood flow. Finally, you will be given an alveolar gas equation. Okay. In this case, if you're going to read one paragraph on physiology of respiration, memorize it, and then you're going to volumes, memorize it. In that case, you will not have a link between one topic to another, and you will not be able to understand the components of alveolar gas equation, and you end up memorizing it. Okay, take it from me, if you just memorize something without understanding the concept of it, that vanishes quickly. Instead, if you try to learn it as a whole topic, okay, at the end you will see alveolar gas equation with multiple components. You see that there is something called as atmospheric pressure. You see that there is something called as partial pressure of water vapor. There is fraction of oxygen in the inspired air. So your brain tells you, okay, these are the important components that you should focus on when you read the entire topic. Okay, now you know what to focus on. So when you read it, the moment the concept says atmospheric pressure is 760 millimeters of mercury, you will try to understand what does it mean. And then you try to find out what is partial pressure of water vapor. Why am I reading about it? Then you will understand that yes, airway adds water vapor as you breathe in. I have to remove that. So all these concepts you will be able to understand only when you get a big picture. So how are we going to get a big picture? By not memorizing a topic paragraph by paragraph, but by going it through once. Right? Give a full reading of one topic, understand what you should focus on, and then give a second reading. When you give a second reading, you will know what to focus on, right? So that is when you will get a big picture. So step number 1 is to get big picture. Step number 2 is to memorize facts. Now you start memorizing atmospheric pressure is 760. Fraction of oxygen in the inspired air is 21%, right? So all these facts, partial pressure of water vapor. So all these facts you will have to memorize. And then you understand the concept. When you understand the concept, it will be like an epiphany moment. When you read about alveolar gas equation, okay, I understand every part of this equation. I understand why I'm going to use this equation. I understand when I'm going to use this equation. Okay, so let me tell you, all of you here, take a resolution today to ask why, right? To ask why whenever you're told a fact or whenever you're told a concept. Okay, so please understand, every medical fact has a reason behind it. Every medical concept has a reason behind it. All of it had already been identified. All of it are available. Do you understand this? It's just that you'll have to seek, understand, and then learn. Okay, so take a resolution that from today, whatever you have done for your NEET UG examination is totally different. Okay, now what are you going to do? You're going to ask yourself why for every fact that is being told and for every concept that is being taught. Okay, and always try to apply. So after you learn a topic, you will have to know that I have to understand how to apply this. Why am I learning this? Don't just memorize alveolar gas equation. You should know, when am I going to apply this? Okay, when I set up a ventilator, I'm going to apply this. You don't have to learn this in your final year. You will have to learn this from your first year. Do you get it? So try to apply, try to integrate. When I say integrate, okay, because of CBME pattern of education, now everybody is trying to align the topic that is being discussed. Even after various attempts, there will always be some sort of misalignment. For example, thorax, they will talk to you about coronary circulation, but it takes some time in biochemistry for you to be taught about cardiac biomarkers. So when you're learning about cardiac biomarkers, you should not feel lazy. Do you understand this? You should not feel lazy to go back and learn about coronary circulation. Okay, try to integrate everything. Okay, this is coronary circulation. When there is a block, this is what is going to happen. And then try to understand the physiology, try to understand the biochemistry part of it. Once you integrate everything, you will find all three subjects to be fascinating. Okay, as I told you, you're going to run a marathon. And this marathon is going to be a pleasant marathon only when you start enjoying the process of running. Okay, not when you treat it as a burden. The moment you treat learning as a burden, you will not be able to memorize anything. Do you get it? So try to integrate everything and learn. Okay, now comes an important question. Okay, I'm going to learn a topic. You said how I should learn, but what am I going to use as my resource? Am I going to be dependent on a video lecture, or am I going to be dependent on textbook? The answer is both. Okay, so they're not mutually exclusive. My answer to you is please learn to use both. Okay, so why should you use a video lecture? So video lecture is definitely better than learning everything from textbook, because textbook is just a visual input that you get, but a video lecture would be a visual and an auditory input. Right? Not just visual and auditory input, we use multiple animations, not just 2D animations, we use 3D animations in all our sessions. So that is going to stimulate your multiple sensory system. Okay, when you learn about memory in physiology, you will understand that more the number of sensory systems that you stimulate, better will be the retention. Okay, so whenever you want to memorize something, you will have to stimulate as many sensory systems as possible. Okay, so read it loud. That helps. Okay, when you're reading it loud, even the jaw proprioceptors go and stimulate the synapse, helps in establishing memory. So you don't have to think I'm an adult learner now, I should not be making sound when I learn, right? There is always an advantage of using as many sensory systems as possible, and that's why video lecture helps you. That's one advantage. Okay, and another advantage is all these video lectures are comprehensive content of every topic. Okay, so every topic will be given as a high yield session wherein the flow is maintained like a story. Okay, so if you ask me to teach about respiratory physiology, what I would say is I would start from what are the inspiratory muscles, what are the expiratory muscles. I will ask you, is inspiration active or expiration active? So I will ask you all these questions. I will induce that I will stimulate you to think. And then you will understand expiration is a passive process. That is why expiration gets cut short at a point, and that is why there is something called as residual volume. After you understand what is residual volume, you will understand what is functional residual capacity. You will understand everything about pulmonary function test just because I've told you something like a story. Okay, so video lectures will be high yield sessions wherein the flow of the concept is made to sound like a story, so that you will be able to link one topic with another within the same concept. Okay, so that's a second advantage. And the third advantage is, as I told you, memorizing facts, understanding concepts, integration, alignment, right? Everything is taken care by the educator. Okay, for example, if you're watching my session on carbohydrate chemistry, I don't just tell you about classification of carbohydrates. I don't just show you the structure of carbohydrate. What I do is I start from the structure. I tell you the classification. I tell you about lactose intolerance, right? When I teach about lactose intolerance, I tell you what are the clinical features. I integrate it with the lab investigation that needs to be done. I integrate with the management part. So everything will sound, it's not just sounding, everything will be like a story, so that you're able to comprehend facts, comprehend concepts, align it, integrate it, and apply it. Okay, and that is why video lectures will definitely help you in your first MBBS. Okay, Now, how about notes taking? Should I take notes? Because PrepLadder does not only give you video lectures, we also give notes, right? And thus that notes is purely based on spaced repetition. So whatever you see as a video lecture, at the end, when you take the notes and when you read it, it will be a repetition of whatever is being taught in the video lecture. So that gives you a spaced repetition mode that helps you in retaining the information, right? Now, apart from this, should you be taking notes? My answer is yes. You will have to take notes because that is going to be a ready reckoner for you during the last phase of the first MBBS, when you're going to revise everything together. Okay, that will be the ready reckoner. So notes taking is a skill. Okay, you should not be writing a running notes. As and when you're reading, you should not be writing. Yes, you can do that if you think writing helps you in memorizing, but that's just like a use and throw notebook just for you to memorize. You don't have to store it. But the notes that you're going to store should be a comprehensive note that you take. Okay, based on whatever you've understood, based on what you think is essential. Okay, so you take a 5-subject notebook, right? You know, one notebook with 5 partitions. So one notebook for one subject. Okay, the first part of the notebook can be devoted only for writing down facts related to anatomy, or facts related to physiology, or facts related to biochemistry. So the first part is only for facts. The next part is only for difference between, right? For example, in biochemistry, lots of difference between you will have to learn: hexokinase and glucokinase, CPS1 and CPS2. So there are some purines and pyrimidines, type A DNA, type B DNA. So all those differences between can be written as a second part. And the third part can be only for why. Okay, for example, today you're learning that vomiting causes metabolic alkalosis. I'm just giving you an example. You don't have to know this fact, okay? You learn vomiting causes metabolic alkalosis. You're understanding why. Write it down. Vomiting causes metabolic alkalosis because of secondary hyperaldosteronism. Okay, so that during the exam, or not during the exam, during your revision period, when you look at the notebook, you understand everything. Everything will get recollected by you looking at your notebook. Okay, and the last part will be for cases, right? Clinical conditions. In biochemistry, you write about all inborn errors of metabolism, clinical features. You write about, for example, lactose intolerance, write down clinical features, lysosomal storage disorders. So that way, this is just my suggestion to you. But you can have your own way of segregating your notes. But ultimately, that notes should be your ready reckoner. Please understand, please get yourself registered, okay, that it's a marathon. It is going to be minimum 11 months from now before you write your examination, and whatever you learn now, you should not forget before the day of examination, but you will forget because that is how your brain works. For you to be able to recollect all that, you need a ready reckoner, and hence notes taking is essential. Hi everybody. Yes, thank you. Okay, so that's about taking notes. So we have already learned about how to learn all 3 subjects in your first MBBS. Okay, now comes the favorite part of mine. Okay, so if I ask you, how many of you like biochemistry? Those of you watching this session, can you please tell me how many of you like biochemistry? If I ask you now, many of you would say, yes, I like biochemistry because you have learned biology, you have learned chemistry. Biochemistry is a mix of both, so you think you would like biochemistry, right? But the same you, okay, might change your perception after you enter into your medical college. Good Bantu, good Sahid. I'm happy to see both of you are liking, would like biochemistry. But this would change after you enter into your medical college. The reason is, your seniors, okay, so your seniors would start telling you that biochemistry learning is like watching a Chinese movie without subtitles. I've heard this, yeah. Seniors say learning biochemistry is like watching a Chinese movie without subtitle because it's all about cycles and pathways. right? Can you see that here? It's about glycolysis, citric acid cycle, HMP shunt. It's all about cycles and pathways. It's all about structures, and it's highly volatile. This is the input that you will get to hear from your seniors. Okay, so those of you watching this session, my advice to you is to not listen to anything which your seniors say. With due respect, okay, yes, they're all seniors. You don't have to listen to what your seniors say, because your seniors have not achieved much yet. Probably they were born 1 year ahead of you, or they got into medical college 1 year before you, right? That's all. They have not seen the real world. They have not understood what actually medical college is. They have not actually understood what needs to be done to be supremely successful. Do you understand that? So don't listen to what your seniors give you as inputs. You devise your own path, okay? And my request to all of you is to try and see the fascinating side of biochemistry, right? What do I mean by fascinating side of biochemistry? It's because the fascinating side, I'm saying it's fascinating because biochemistry is not just about cycles and pathways, right? Biochemistry is not just about structures. Take it from me, when you start practicing, okay, 70% of the investigations that you will write as prescription will be biochemical. Okay, it is not just about treating a critically ill patient. Even for treating a patient who has come to you with trauma or with infection or some milder illness, okay, whenever you're saying that you're managing the patient, it means you're managing the patient to achieve biochemical homeostasis. Okay, so health and disease differentiation is totally based on biochemical homeostasis. Okay, so everything is evidence based. When you start practicing, everything has to be evidence based. You should show that this is the report that I got, and that is why I'm managing the patient this way. Okay, and all of that are biochemical investigations. Okay, so it is not just about cycles and pathways. I strongly urge all of you to try and see the fascinating side of biochemistry, and that is possible only when you apply biochemistry. Okay, and that application part is possible if you start learning the subject with the big picture. Okay, so now how to learn biochemistry? We know this is the fascinating side. It's all about treating a patient, but how to learn biochemistry? The moment you enter into medical college, the first question that you have is, which textbook should I follow for biochemistry? Should I stick to one textbook, right? So have you been asking these questions to your seniors and to your professors? Should I stick to one textbook? Which textbook should I read for biochemistry? Okay, just remember, getting a holistic view of the subject should be your aim. And you will be able to get a holistic view of biochemistry only when you follow this. Okay, do not stick to one textbook as reference. Why am I calling it as reference? Because your primary source is going to be a video lecture that you're watching. Okay, and you're going to use these textbooks as reference. When you're using these textbooks as reference, do not stick to one textbook. Okay, my recommendation is for you to use a textbook which is illustrative. Yeah, it has to be completely illustrative, and the language should be as simple as possible. Right? So which textbook do I recommend? I recommend Lippincott. You love chemistry, but you're forced to take medicine. Sahid, you will learn lots of chemistry in medicine. Okay, so those of you have taken this decision of entering into medical college, which is not voluntary decision. Okay, I am with you because I did not want to join medicine. I was forcefully pushed into medicine because my mom wanted me to do medicine. Okay, but now do I have any regrets? No, I have zero regrets. I am thankful to my mom for having pushed this on me. Okay, because as I told you when I started the session, no field can be as gratifying as medicine. Okay, yes. So what was I telling you? I was telling you that you will have to use Lippincott. Okay, and top it on with Harper. Okay, because many of the questions are straight away from Harper, but if you try reading Harper directly, that will be very difficult. So step number 1, use Lippincott as first reference. Once you have understood, probably you can have a check of Harper to see what are the facts that are additionally given in Harper. Okay, and because I said you have to apply and learn, you can use a clinical biochemistry book as reference. For example, when you're learning about electrolytes, okay, in biochemistry textbooks, electrolytes will be given purely as biochemical aspect. But if you want to learn the applied aspect of electrolytes, then you can use clinical biochemistry book like Crook. So these are all suggestions. This is not mandatory. Okay, it is not mandatory that you have all these 3 reference books. All these reference books are available as PDF. I'm not asking you to spend money on it. Use all these as references for you to understand concept, for you to understand why behind whatever you learn. Okay, so this is about what books to follow. And then about topic sequence, right? When you start learning biochemistry throughout this year, which topic should you learn first and which topic should you learn next? Of course, I would recommend that you follow the sequence that is being followed in your college, because I don't want any sort of misalignment here. And whenever there is a misalignment, you will neither be able to follow what is being done in college, nor will you be able to follow what you want to do. So I would strongly recommend that you align yourself with the schedule that is given to you from the college. But during the end of the course, right, towards the end of the course, when you start revising, you will have to start from cell. Okay, so start learning from cell, because that is where you learn about transport mechanisms. That is where you learn about the various suborganelles, the pathways happening in various suborganelles. So again, you will get a big picture about the entire metabolism if you learn about cell. Okay, after you learn about cell, chemistry and metabolism of carbohydrates. Okay, then you learn about chemistry and metabolism of lipids, chemistry and metabolism of proteins and amino acids, in that order. Do you all understand this? First learn chemistry, then learn metabolism of carbohydrates, then chemistry of lipids, metabolism of lipids, chemistry of amino acids and proteins, metabolism of amino acids and proteins. Please learn in this sequence when you're revising the entire subject. Okay, and that should be followed by you learning about vitamins. Because what I've generally seen among students is, yes, vitamin is a high yield topic, be it in the university exam or in the NEET PG entrance. There are many questions that are asked in vitamins. That doesn't mean you should start revising from vitamins, because you'll be able to understand vitamin only when you have a strong conceptual understanding of metabolism. Right? Vitamins play a crucial role in metabolism, for which you should know metabolism. Okay, and then learn vitamins. Between metabolism and vitamins, you can learn about enzymes. Okay, because you know what each enzyme does. Once you know what each enzyme does, if you learn about enzymes, classification, kinetics, then you will be able to relate to it. Okay, so cell followed by all these metabolism, and then enzymes, vitamins, and then learn minerals. Okay, now genetics. Okay, so all of you listen to this. Understanding genetics is essential. Okay, because the entire medical field is progressing towards, or proceeding towards, personalized medicine. Personalized medicine is managing a patient based on the genetic makeup of an individual. So for you to be able to understand personalized medicine, you should have a strong understanding of genetics, and that starts from biochemistry. Okay, so before you finish your first year MBBS, you should have a strong foundation on genetics. That should be your aim. So when you learn genetics, do not like jump from, jump to the 26th floor all of a sudden. Okay, don't just start learning about techniques. You will have to start from the very basic fact, learn about bases, learn about nucleosides, nucleotides, build all concepts gradually, and then start applying. Okay, so that you have a clear understanding when you get into clinical subjects. Okay, so you'll have to learn genetics, and then nutrition. Okay, I'm not in my late age. I might be older than you, but I won't agree if you say I'm in my late age. So these are the topics, and this is the sequence in which you will have to learn all these topics. Okay. Now, we have been discussing only about theory part. What about practicals, right? First MBBS, you also have practicals. So first and foremost, practical sessions do not skip. Not just for attendance, right? It's not just for attendance. You will have to attend every practical session. Okay. And when you attend the practical session, yes, you should get a hands-on training on all the procedures that are being done. But in the examination, right, if I come as an examiner, I will be least bothered about how you do the test, because when you become a clinician, you're not going to perform any of these tests. So I'm not bothered about the procedure, or I'm not bothered about how the test is being done. I am more worried about your understanding of principle of the test. I'm more worried or interested about your understanding of interpretation of the test. Do you get it? For example, Benedict's test, right? You will be doing Benedict's test in your first year MBBS biochemistry practical. I'm least bothered about how you do the test, right? You take 5 ml of the Benedict solution, you add 8 drops, you heat it. That is the procedure. I'm not even going to observe if you're doing it right or wrong. And even the paper, I will not see whether you took 5 ml of Benedict solution or you took 5 ml of the urine. I'm not bothered. Okay. What will I check? I will check if you know the principle of the test. I will check if you know why are you performing this test. What if the test is positive? What is your diagnosis? What are the differential diagnosis? What are the conditions in which Benedict's test will be positive? So I want you to focus on clinical conditions related to every test that you're asked to perform in the lab. Okay, do you understand that? And always try to find out the reason behind the observation. Okay, for example, if you say in Benedict's test, blue color becomes red, you should understand why blue becomes red. You should know copper sulfate has cupric ions, and that gets reduced to cuprous ion that is red in color. That is why the red color is observed. So you should understand and reason out every observation. Okay, and if you want to know which book to follow for practicals, personally, I like Evangeline Jones. Okay, Evangeline Jones is a practicals book for biochemistry. I like this book because everything is explained, right? Everything is reasoned out. So you will be able to get an entire understanding of practical sessions if you read this book. Okay, so that's about practicals. Now, how many of you are worried about the next exam, right? So these days, now it's NEET PG entrance examination that is happening, and you've just entered into medical college. And I know many of you would have been told about this next exam. There are so many speculations about next exam. And if you're asking me, what do I think about this next exam implementation? I would say I'm not bothered about whether it is NEET PG or next exam, because I know how you're going to learn, right? When you learn all 3 subjects conceptually, when you learn all 3 subjects in an applied manner, NEET PG examination or next exam will not matter, right? You will be able to clear any examination. That is the kind of confidence that you should have at the end of your first year. Okay, and is that possible? Yes, it's possible. And for that, should you burn the midnight oil every night? No, right? You have to be just systematic. You have to be consistent. Just ensure that you spend 2.5 hours every day in the evening for learning all 3 subjects, 5 hours during a weekend. Okay, and then take every internal assessment seriously. And when you prepare for your internal assessment, it should not be a question-based learning. It should be again conceptual learning, so that any kind of question that is being asked in the exam, you are going to be successful. Okay, so should you be worried about NEET or next? No, nothing to worry about, right? They were saying 2000 students of 2000 batch, 2020 batch, right? Students of 2020 batch will be facing next exam, which is supposed to be in 2025. right? It was the latest announcement, but everything is put on hold. No official information so far. So don't worry about whether it's going to be NEET or next. It's all about your responsibility of committing yourself to this course. Okay. So the summary is, from the very beginning, be curious. Okay. Find out every chance and opportunity to learn. Okay. And this is my favorite quote. Okay. Mediocrity is a sin. What does it mean? Right? Whatever may be the task that you're trying to perform. Okay. Do not aim for mediocrity. Do not settle for mediocrity. It should be perfect. Right? If you're taking a seminar, that seminar has to be perfectly planned. It has to be perfectly designed. And you should know what kind of information you're going to transmit to other students, right? Not just seminar. If you're going to spend 2.5 hours every day, I should have a schedule for it, right? And the 2.5 hours, I will be mindful about how I spend my time. I'm not going to be multitasking. I'm not going to have my mobile on one hand, watch Instagram reel on one side, and then look at video lectures on the other side. Please understand, multitasking is a myth. Right? Multitasking is a myth. So you have to practice mindfulness, you have to practice perfection, and you have to practice conceptual understanding of all three subjects, right? If you do that at the end of the first MBBS, you'll be very confident about all these three subjects. And these three subjects are not preclinical subjects. Have you all understood this? They're not just preclinical subjects. If you don't have an understanding of biochemistry, take it from me, you will not understand pharmacology. You will not understand medicine. Okay. If you don't understand anatomy, you're not going to understand ENT, you're not going to understand ophthalm, you're not going to understand surgery. So many a times your seniors complain to you about having to spend so much time in reading only because they have not set their foundation right. Okay. You have enough time. Okay, you have enough time ahead of you, so you can frame a strong foundation for yourself in the first year, so that when you proceed to upcoming years, you're able to apply whatever you've learned in the first year. Okay, so this is a summary of this session. I hope this session helped. Yeah, so thank you and all the best. So some of you have been asking, should I practice MCQs and PYQs on a daily basis? Practicing MCQ helps, practicing PYQs help, but that should not be the only way of learning. I've seen students just looking at previous year questions and then memorizing the answer for that. Please don't do that. Okay. First, read the textbook. First, watch video lectures. Read the textbook. Take notes. Understand it. And then look at PYQs. PYQ should be the last resort for you, not the first one. Okay? Anything else? Thank you. Good night.